Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Imagine seeking medical care at a hospital or clinic only to leave with a life-threatening infection. Today, we'll be discussing how to protect ourselves and loved ones from infections when visiting hospitals, clinics, or other healthcare settings. Joining me to share valuable strategies to safeguard our health in these settings is Infection Prevention and Control Manager, Tebogo Louw.
All right, thank you for having me. So my name is Tebogo Louw. I'm a profession, I'm a registered nurse. I'm currently working as an infection control manager for a healthcare group. I'm very passionate about good clinical outcomes. I'm passionate about patients. I'm passionate about the little things, the small wins that have big impact. And we'll dive into those as we speak.
Thank you so much for that lovely introduction, Tebogo. I guess let's move straight into our topic regarding how to protect ourselves from infections when in healthcare settings like hospitals or clinics. So, Tebogo, what are some of the most common infections that patients and visitors are exposed to in hospitals and clinics? And can you just explain how these infections typically spread in healthcare settings?
So the most common infections that patients and visitors are exposed to in hospitals and clinics are normally surgical site infections, urinary tract infections, bloodstream infections, respiratory conditions, pneumonia, and gastrointestinal infections. And these infections are typically spread in healthcare settings through close contact of infected patients, contaminated surfaces, improper hand hygiene, or invasive medical devices. So before I actually dive deep into how the clinic setting is different from the healthcare setting, I'm just going to paint a picture. So how they spread is how they can be through contact. So contacts can be direct or indirect. So if I touch someone who's infected and I touch myself, that is direct contact. If I touch someone's surroundings who's infected, and then I touch myself, that is indirect contact. Even if I touch one patient, I go to the next, that is direct. If I touch a patient's surface, next patient, that is indirect contact. So there's those two. They are both contact, but they can be direct or indirect. The second aspect is there is droplets and there is airborne. Anything that is greater than 5 micrometer will fall to the ground. We consider that as droplet because it's heavy. Anything that is less than 5 micrometer will float in the air. So if you've ever played with sand as a kid, if you take sand in your hand and you throw it in the air, the lighter part will float like dust. The heavy part, those heavy ones will fall on the floor. That's the same thing when someone coughs, sneezes. That's what happens. It's either they release those droplets or the airborne. So the airborne, they float in the air. Droplets, they have to come into direct contact with your eyes, lips, nose. Whereas with the airborne, you have to inhale it. Like if you ever go into a dusty area, that's the type of setup. The difference, you won't feel the inhalation in this particular scenario. So when you look at clinics in particular, clinics have a patient turnover. Clinics often see high volumes of patients. This leads to increased opportunities for cross-contamination in any of those modes. The limited space. Many clinics have limited space, making it hard to implement proper infection control measures to maintain adequate distancing between the patients. And then comes the obvious one. They have variety of patients' conditions coming in there. We don't actually, like in the ED, you wouldn't have an active triage system where you separate patients. Patients will be sitting there with different conditions before they even diagnose. So you can't really start implementing transmission-based precautions to control it because you don't know what the patient is presenting with. And we don't segregate them in a sense to say respiratory this side, diarrhea this side, because we only know after patients have been screened. And when you do that segregation for chronics and acute patients, it's considered stigmatization. But I know clinics have gone that route to try and control it. So that's just to paint a picture around how they can spread.
Tebogo, can you just enlighten us on some common mistakes that patients make that increase the risks of acquiring an infection in a healthcare setting?
So common mistakes that patients make, the biggest one is not practicing proper hand hygiene. Failing to wash your hands thoroughly or using a hand sanitizer that is provided at the clinics can allow the spread of bacteria and viruses. The other thing is not adhering to prescribed medication. Skipping doses, not taking medication as prescribed leads to drug-resistant infections. Typical examples, antibiotic. Finish the full course, a person feels better for 3 days, they stop it, that creates resistance, therefore making them prone to infections and resistance. Other things that patients are educated after they perform a go-to theater for any procedure. Not following post-operative care instructions can also lead to patients exposing themselves to infections because we say do not do this. And then you go to a neighbor says, I've actually used this and it worked for me. And then you do it, then you become septic. Another thing is, as patients, not asking the healthcare provider to wash their hands, not holding them accountable. It's funny how we always at home, when you be like preparing a meal, you be like, wash your hands, but we're not asking the same as the healthcare provider, because they're about to perform a procedure that's supposed to be clean on me and reduce cross-contamination. And then again, not being proactive about asking questions as well. Find out more. What is my condition? Why am I in this situation? So the next time you come and get admitted, you can be able to share this information. Another thing that puts patients at risk is that when you give history, when you are being seen by a doctor, a nurse, at any healthcare facility, you need to give proper history. Have you been admitted? What treatment were you put on, if you can recall? Have you ever been isolated in another hospital? Then that helps us control the risking other patients as well. Last one, obviously, some key steps is patient and visitors can take to protect themselves from infectious conditions is obviously just following instructions that are displayed. You will always see IPC, infection prevention and control practices that are displayed around the hospital, how to wash your hands, use a D-gel, sit here, wait here. All those things are done there to protect the patients. If we just follow those instructions, then it can help in preventing further spreads.
You just touched on hand hygiene, and I'm aware it's something that is highly promoted in healthcare settings. So, Tebogo, can you just briefly explain why hand hygiene is so crucial in preventing the spread of infections in healthcare settings?
So, hand hygiene is crucial in preventing the spread of infection in healthcare settings because hands are the most common cause of transmission for bacteria and viruses and other organisms. Healthcare providers' hands can become contaminated with pathogens from patients, medical equipment, or the environment. By practicing proper hand hygiene, including hand washing with soap and water or using an alcohol-based hand sanitizer, healthcare workers can effectively remove or kill microorganisms off their hands and prevent the transfer of these pathogens or patients to other patients or surfaces. So the importance of hand hygiene cannot be overly expressed or overly emphasized. And hand hygiene is key in controlling most infections because they're, like I said, the majority of them, they are through contact, and contact happens with our hands, or directly or indirectly. I always like to take things back to a home setting. When you're about to prepare a meal, you're expected to wash your hands because you don't want to contaminate the food. It's the same thing. If you come into contact with blood or anything, you wash your hands. It's the same thing. If your hands are visibly dirty, you wash your hands. So hand washing is not something that is new. If you come into contact with a dirty surface at home, you wash your hands. It's not new. It's always been there through our life. We just decided that in hospital settings, we're going to formalize it. We're going to use it based on evidence, and we're going to be scientific about it. And that's why we say hand hygiene is crucial. And right now, we are doing what we call 5 moments, and this is what we should hold our healthcare workers accountable to. Are they washing their hands before they touch their patients? Are they washing their hands? At this point, it's alcohol hand rub. Are they using alcohol and rub or washing hands before aseptic technique? After exposure to body fluids, after coming into contact with my surroundings, after seeing me, did we observe any alcohol hand washing? Because these are things that have always been there, and they can prevent and control the spread of infections in any healthcare settings, whether it be in hospital or outpatients.
Tebogo, are there any other key steps that patients and visitors can take to protect themselves from infections when visiting a hospital or clinic that you can share?
I think what's important when you look at patients coming into health settings, first of all, the instructions are there and should be followed. So when you go into a bag and they say to you, please do click there for your service so you can be on part of the waiting or some queuing system. If you don't click there, you won't get the service. In healthcare services, you walk in there, we give you instructions. You follow those instructions, whether you follow them or not, just to get the service. But the point I'm trying to make is that instructions are important. They were done because based on evidence. So firstly, it's the instructions, which will always tell you, first of all, always wash your hands. Hand hygiene, we already spoken. I can't think of how further to emphasize it. Keeping our wounds covered when we come to the hospital, following any infection control guidance that are there in any settings where we observe and adhere to any posted infection control protocols. I can overemphasize that. When COVID struck, we were all wearing masks, but now someone can go consult for a flu without wearing a mask. The same concept applies. Wear a flu, wear a mask, and expect others who are treating you to wear a mask if you are exposed to droplets, because then you get exposed to this one. The other thing that is important, we need to stay up to date with vaccinations. Ensure that your family and yourself are vaccinated. That can protect you from getting cross-contamination or any other conditions that can occur to a person if you're not vaccinated. We live in just the typical COVID, for example. They said vaccination will stop COVID or anything like that. You might get it, might not get it. Or when you get it, might not make it that severe based on whatever research. Typical things like vaccination for measles and etc. Those things are important because they reduce the probability of a condition happening and give you some sort of immunity. And then we can avoid visiting sick friends unnecessary. My friend is sick, you want to go give support, we go there unprotected. By the time we come to hospital, we cause cross-contamination. And one thing people must always do and patients must always do, advocate for your own safety. Don't be afraid to ask the healthcare providers if they have washed their hands or clarify any concerns you have about infection control practices. In most private healthcare settings, the stats is there to say what is our most prevalent. People are putting that out there on the website. You can easily go look at that and see what is the measurements and what are we doing well on, what are we not doing well on. And this is something that is being worked to be translated in the public sector as well. Same thing, similar with clinics, but the transparency is important. And this is just to emphasize that as a client or a patient, you have the right to ask and to be protected.
Tebogo, thank you so much for mentioning such important and valuable points. To wrap up our conversations, Tebogo, how can hospitals and clinics improve their infection control practices to provide a safer environment for everyone?
There's two tiers that we often look at. We call them standard precautions and transmission-based precautions. So the P for prevention is standard precautions. So standard precautions are put in place to prevent most organisms. And then the C, which is control, is obviously transmission-based precautions. So if you're always controlling more than you are preventing, then there's a gap there. So what I want to emphasize is that every healthcare organization or facility or any service provider that deals with people's health needs to ensure they're spending more time preventing than controlling. This can be done by ensuring that staff educate, staff training, provide a comprehensive ongoing training of healthcare workers on infection control protocols, hand hygiene, proper use of protective equipment, environmental cleaning, sharp waste. So strict adherence to guidelines is very important. Ensure strict adherence to infection control guidelines and protocols, including proper sterilization, medical equipment, environmental cleaning, like previously mentioned, and handling of infectious waste is very key. And then you need to ensure, like we already emphasized hand hygiene a lot, you need to ensure regular hand hygiene audits. We're looking at now, we're moving to monitoring 5 moments, do that observer training, do a whole program, make sure staff understand what they're looking for. So conducting regular audits and feedback mechanisms to monitor and improve hand hygiene compliance amongst healthcare workers. Patient education is important. Whenever a visitor comes into the hospital, we need to educate them what is our expectations and what they need to follow and why. So they make an informed decision, even in future, then they're able to cooperate. The biggest things, again, it's always important that you invest in your infrastructure. A well-ventilated environment is key for IPC. Having an environment where you can isolate patients, appropriate spacing in case of airborne transmissions and droplet transmissions is very key. And then collaboration and communication, this cannot be emphasized more than anything. Fostering open communication, collaborating amongst healthcare teams to ensure effective infection control practices and sharing of information is important. And then using and not abusing antibiotics. We're going to an era where antimicrobial resistance is big. So it's important that we use our antibiotics wisely and as needed. And this is where, again, the client can be able to say, what antibiotic am I being put on? And how long should I take it? It gives them power. So for hospitals to prevent it, I would say antimicrobial stewardship, best care always bundles, they must be well coordinated as well.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. That's all for today's crucial conversation on protecting yourself from infections in healthcare settings. By following simple precautions such as hand washing, avoiding unnecessary contact, staying informed, and advocating for safe practices, you can significantly reduce your risk of infection.
Small actions like proper hand hygiene and being aware of your surroundings can also make a huge difference in preventing infections. Remember, your health is in your hands. So the next time you find yourself in a hospital or clinic, stay vigilant and stay safe. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.